Experimental design questions appear frequently on the BCBA exam, and recognizing their core patterns helps you answer them with much more confidence. Rather than memorizing terms, it's more effective to understand how each design demonstrates control. In this walkthrough, we'll break down real exam-style questions using simple, clear logic. If you want full-length mock exams and complete video explanations, you can find everything at bcbamockexam.com. Experimental design is much easier when you focus on the patterns each design creates. Reversal designs show control by returning to baseline, while withdrawal removes treatment without needing an initial baseline. Multiple baseline demonstrates change through staggered implementation across behaviors, settings, or individuals. Alternating treatments relies on rapid session-by-session switching to compare interventions quickly, and changing criterion uses stepwise goals that behavior should follow. A few quick rules help you classify a design fast. Reversal gives the strongest control. Multiple baseline is used when withdrawal is unsafe. Alternating treatments is for fast comparison. Changing criterion is for gradual shaping. And withdrawal is identified when treatment is removed without an initial baseline. Question 1. A BCBA uses an ABAB reversal design to test whether praise increases on-task behavior. During the second baseline, behavior does not return to initial levels. What should the analyst consider first? A. The praise intervention is not effective. B. Carryover or sequence effect. C. The baseline definition is incorrect. D. Motivation randomly changed. This question is asking you to notice what it means when the second baseline does not return to the original level. To approach this question, remember that reversal designs depend on behavior returning to baseline when treatment is removed. If behavior stays high during the second baseline, the most likely explanation is carryover, practice, or maintenance effects. A simple way to evaluate this question is to look directly at the second baseline pattern and ask whether the behavior truly reversed. If it didn't, the explanation is almost always related to residual effects of the intervention. Reversal designs rely on prediction and verification, and poor reversibility suggests that the behavior remained influenced by the treatment. Use the rule: if the second baseline doesn't drop, think carryover, not intervention failure. The correct answer is B, carryover or sequence effects. When treatment is withdrawn but the behavior stays elevated, the learner may have contacted reinforcement history, practiced the skill enough to maintain it, or simply kept performing at a higher level. This does not indicate that the intervention failed. It only means the reversal pattern did not appear. Option A is incorrect because the treatment did increase behavior during the B phases. Option C does not explain why the second baseline remains high. Option D is unlikely because random motivation shifts do not create consistent patterns. When the second baseline fails to drop, carryover is the most appropriate explanation. Question 2. A BCBA wants to determine if a self-management intervention affects homework completion. The analyst implements the intervention across 3 settings at different times. What design is being used? A. Changing criterion. B. Multiple baseline. C. Alternating treatments. D. Withdrawal. This question focuses on identifying the design that uses staggered implementation across settings. To approach this question, look for the key phrase describing intervention introduction at different times across settings. Multiple baseline designs use staggered timing to show that behavior changes only after the intervention is introduced in each tier. This visual pattern is one of the clearest ways to identify the design. Changing criterion, alternating treatments, and withdrawal do not involve staggered starts, so they can be eliminated quickly. The quick rule here is straightforward. Staggered introduction means multiple baseline every time. The correct answer is B, multiple baseline. Each setting changes only after the intervention is introduced, demonstrating functional control without withdrawing treatment. This design is especially useful when reversal would be unsafe or unethical. Option A is incorrect because there are no stepwise goal changes. Option C is incorrect because no rapid alternation occurs. Option D is incorrect because nothing is withdrawn. Staggered timing is the essential feature that identifies this design as multiple baseline. Question 3. A BCBA rapidly alternates between token economy and NCR sessions to compare their effects on out-of-seat behavior. Which design is being used? A. ATD. B. Changing criterion. C. Withdrawal. D. Multiple probe. This question is about recognizing the meaning of rapid switching between conditions. When approaching this question, pay attention to the rapid alternation between treatment conditions. Alternating treatments designs rely on session-by-session switching to compare two or more interventions quickly. Clear visual distinction between conditions is a hallmark of this design. There are no shifting criteria, no staggered rollout, and no treatment removal, so those other designs do not match. When the question mentions rapid alternation, ATD is the most logical answer. The correct answer is A. Alternating treatments. This design allows fast comparison by switching conditions session by session, helping the BCBA determine which treatment is more effective. Option B is incorrect because changing criterion requires sequential goal adjustments. Option C is incorrect because withdrawal removes treatment instead of alternating it. Option D is incorrect because multiple probe involves intermittent baseline collection rather than rapid alternation. The fast switching pattern clearly identifies an alternating treatments design. Question 4. A BCBA wants a student to increase water intake. The target increases gradually. 2 cups per day, 3 cups per day, 4 cups per day. Which design is used? A. Changing criterion. B. Reversal. C. Multiple baseline. D. Alternating treatments. The hint here tells you to look for gradually shifting goals. To approach this question, look for the stepwise progression of goals. Changing criterion designs rely on gradually shifting criteria that behavior should follow. The essential feature is that the learner's behavior adjusts in the same direction and tracks each new level. There is no staggered implementation, no rapid alternation, and no return to baseline, so the other designs do not fit. The exam rule is clear. Stepwise goals signal a changing criterion design. The correct answer is A. Changing criterion. Behavior is expected to follow the progression of increasingly demanding criteria, which demonstrates control in this design. Option B is incorrect because reversal requires a return to baseline. Option C is incorrect because there is no staggered pattern. Option D is incorrect because nothing alternates. The gradual increase in criteria is what defines changing criterion. Question 5. A BCBA removes reinforcement after treatment to evaluate behavior change. However, no baseline was collected before treatment. Which design is this? A. Reversal. B. Withdrawal. C. Multiple probe. D. ATD. This question asks you to distinguish between reversal and withdrawal based on the presence of a baseline. To approach this question, recall that reversal designs require an initial baseline before treatment. Withdrawal designs do not require a baseline and begin by removing treatment immediately. A simple way to reason through this is to check whether the sequence begins with treatment. If it does, and treatment is removed to assess change, it fits withdrawal, not reversal. Multiple probe and ATD can be ruled out because they rely on intermittent baselines or alternating conditions, neither of which appears here. The key rule is, no baseline means it cannot be a reversal design. The correct answer here is B. Withdrawal. In this scenario, reinforcement is removed after treatment, but there was no baseline phase before treatment started, which rules out a true reversal design. Withdrawal designs remove an already ongoing treatment without requiring an initial A phase. Reversal, in contrast, must follow a BAB and always includes an initial baseline, so option A is incorrect. Multiple probe designs, option C, are based on intermittent baselines and staggered probes, not simple removal of treatment. ATD, option D, alternates between conditions rather than withdrawing one, so it does not match either. A simple rule is, if there is no baseline, it is never a reversal design. Question 6. A BCBA uses an ABAB reversal design to test an intervention. In the second baseline, behavior decreases even further instead of increasing. What is the most likely explanation? A. The intervention was ineffective. B. A confounding variable influenced behavior. C. The baseline was too short. D. The graph was interpreted incorrectly. Here you are being asked to interpret what an unexpected change in the second baseline tells you about what might have happened in the environment. To approach this question, Remember that reversal designs rely on behavior moving in opposite directions when intervention is present versus when it is absent. During baseline, behavior is expected to show one level, and during treatment, it should move in the opposite direction. If, in the second baseline, the behavior drops even further instead of rising back toward the original level, the first thing to consider is that something else in the environment changed. This is what we call a confounding variable, such as a schedule change, unplanned reinforcement, medication changes, or sleep issues. These kinds of shifts disrupt prediction and verification because the pattern no longer reflects only the presence or absence of the intervention. A short baseline might affect how well you can predict trends, but it does not explain a baseline moving in the opposite direction. Thinking this way keeps the reasoning simple and focused on environmental changes. The correct answer is B, a confounding variable influence behavior. When behavior changes in an unexpected direction during a baseline phase, it usually means some external factor has entered the picture, such as environmental changes, schedule changes, unplanned reinforcement, or medication or sleep effects. These factors interfere with the ability to demonstrate prediction and verification in a clean reversal. Option A is incorrect because you cannot judge intervention effectiveness by looking only at baseline behavior. Option C is wrong because a short baseline affects prediction, but it does not cause the behavior to shift in the opposite direction. Option D is unlikely because ABA exam questions are generally testing your understanding of design logic, not simple graph reading errors. The most reasonable interpretation in this situation is that a confounding variable altered the behavior. Question 7. A BCBA uses a multiple probe design to evaluate a reading intervention. Baseline data are collected intermittently instead of continuously. Why is a multiple probe design appropriate here? A. Continuous baseline would risk learning effects. B. Alternating treatments requires limited baseline. C. The target behavior is reversible. D. The intervention must be compared to NCR. This question is asking why intermittent baseline fits this kind of design. To approach this question, focus on how multiple probe designs handle baseline measurement. In a multiple probe design, baseline is collected intermittently rather than continuously, which helps prevent the learner from improving just because of repeated testing. If baseline were taken every session for a skill like reading, the child might get better simply from the extra practice, which would blur the effect of the actual intervention. Using intermittent probes avoids unnecessary repetition and reduces reactive or learning effects, while still allowing the BCBA to check progress. Alternating treatments and NCR comparisons have nothing to do with this baseline strategy, and reversibility is not the core issue here. Whenever continuous baseline might itself cause improvement, a multiple probe design is a good choice. The correct answer is a continuous baseline would risk learning effects. Multiple probe designs are specifically useful when repeated measurement during baseline might accidentally teach the skill or improve performance. By collecting baseline intermittently, the BCBA reduces the chance of unnecessary repetition and accidental acquisition while still maintaining control. Option B is incorrect because alternating treatments does not require intermittent baseline and is unrelated to the logic of multiple probes. Option C is wrong because reversibility is not the concern in this situation. Option D is unrelated, since comparing to NCR has nothing to do with how baseline is collected. The key point is that intermittent baseline protects against learning effects that would occur with continuous measurement. Question 8. During an alternating treatments design, the data paths for treatment A and treatment B overlap heavily. What conclusion can the BCBA draw? A. Treatment A is clearly superior. B. Both treatments are equally effective. C. Experimental control is weak due to poor differentiation. D. Treatment B should be withdrawn immediately. This question is about how to interpret overlapping data paths in an ATD. To approach this question, begin by recalling that alternating treatments designs depend on clear visual separation between treatment conditions. The purpose of ATD is to compare treatments by switching them quickly and then examining their distinct data paths. When the lines for treatment A and treatment B overlap heavily, it means the design cannot show which treatment is better. Overlap does not equal equally effective. Instead, It signals that the results are confounded and not easy to interpret. The key insight is that strong experimental control in ATD requires good differentiation between conditions. When paths overlap, any conclusion about superiority or equivalence is not justified. This is a common exam trap, so it helps to link overlap directly with weak control. The correct answer is C. Experimental control is weak due to poor differentiation. Alternating treatments designs only identify relative effectiveness when the data paths separate clearly. If they overlap, the BCBA cannot confidently determine which intervention is better. Option A is not supported because overlapping data do not show that treatment A is superior. Option B is also incorrect, since overlap means the results are inconclusive, not that the treatments are truly equal. Option D has no basis here, as there is no evidence that treatment B should be removed. The issue is with interpretability, not harm. The key point is that in ATD, overlap equals a confounded design and weak experimental control, not clear treatment conclusions. A student's stepwise goals are 5 minutes, then 8 minutes, then 12 minutes, then 15 minutes of sustained work. However, when the criterion shifts from 8 to 12 minutes, the student's performance stays at 8 minutes for many days. What does this suggest? A. The intervention is ineffective. B. The criterion change was too large. C. The student needs a reversal. D. The baseline was unstable. This question is about how to interpret stalled performance in a changing criterion design. To approach this question, remember that changing criterion designs require behavior to move in the same direction and adjust with each new goal. As the criterion increases, the learner's performance should gradually match the new level. If performance stalls and remains at the previous step, it usually means the new step is too big for the learner at that time. In other words, the change in criterion was not aligned with the learner's current ability. The intervention might still be working, but the step size is unrealistic. Reversal is not needed here because changing criterion already demonstrates control when steps are appropriately sized. Baseline stability is not the main issue, since the problem occurs during the progression of criteria. The simplest rule is, when performance gets stuck, think about whether the criterion step is too large. The correct answer is B. The criterion change was too large. Changing criterion designs depend on incremental, achievable steps so that behavior can follow each new goal. When the learner cannot reach the new criterion and stays at the previous level, the design cannot show clear control at that step. Option A is incorrect because the intervention itself may still be effective at the earlier levels. Option C is wrong. There is no need to introduce a reversal when the issue is the size of the criteria. Option D does not apply because baseline is not the problem in this situation. The step performance simply indicates that the jump from 8 to 12 minutes was too big. Question 10. A BCBA wants to compare two reading interventions quickly while the school wants immediate results. Which design is most appropriate? A. Reversal. B. Multiple baseline. C. Alternating treatments. D. Changing criterion. This question focuses on choosing a design that allows for rapid comparison of two interventions. To approach this question, pay close attention to phrases like compare two interventions quickly and immediate results. These phrases point directly to the need for speed in evaluation. Alternating treatments is the only design that can compare interventions rapidly by switching conditions session by session. Reversal, multiple baseline, and changing criterion all require more time to establish patterns and do not provide fast comparisons. ATD also has the advantage of not requiring a baseline or withdrawing treatment, which is practical in school environments. A simple exam strategy is, whenever a question emphasizes quick comparison of two treatments, think of ATD as the default choice. The correct answer is C, alternating treatments. ATD is specifically designed to compare treatments rapidly without requiring a baseline or withdrawal of intervention. It switches conditions session by session and provides quick, actionable information about relative effectiveness. Option A is incorrect because reversal requires multiple phases and takes longer to complete. Option B is wrong because multiple baseline depends on staggered implementation, which slows down decision-making. Option D does not fit, as changing criterion is used for gradual shaping, not fast comparison between treatments. The efficient, rapid comparison built into ATD makes it the best choice for this question. Experimental design questions are some of the highest leverage items on the BCBA exam because they test whether you truly understand how behavior analytic research demonstrates control. Now that you've walked through these examples, you can look at patterns like reversal, multiple baseline, alternating treatments, changing criterion, and withdrawal with much greater clarity. As you keep practicing, try to link each exam scenario back to the core logic of the design rather than just the label. If you'd like full-length mock exams, detailed video walkthroughs, and exam analytics to guide your study, you can find them all at bcbamockexam.com so you can study smarter, not harder.